Yeah, thank you for coming on and sharing your thoughts about integrative and functional medicine.
Yeah, honored to be here. It'd be a good
I
time.
had no idea. You should start creating some videos about that.
Yeah, so you're it's funny you say that. So like for forever, right? Everybody's like, you should be on social media more, you should do this. I was like, well, one, I despise social media. It's just so much crap out there. And everybody, it's all passive aggressive, and people will just have no problem saying whatever they want. And also time, right? I didn't have time.
Right.
So then, but everybody pressuring me, and just times have changed, and patients and friends and family and people in the industry are like, you just need to be, you know, just dispelling myths and letting people know more about health and wellness, kind of like this podcast, and
Yeah.
also displaying just dispelling myths and misconceptions and misinformation and disinformation about dietary supplements, the industry itself. Because all these people that are out there, for the most part, the influencers, they have no health background, they have no medical training, and they're just espousing crap. And it's doing harm because I see these patients. They're like, "Oh, I saw this TikTok ad or this Meta. Is this good supplement?" And I'm like, "No, don't take that." Or
That's
we
why
don't even.
that's why you need to speak about this. It's
Yeah,
very unique. Like my sister is a functional doctor and she's always looking to create supplements. Now I know who to talk to,
yeah,
and she's been practicing for 10 years now and she has a functional medical doctor. And to be honest with you, this kind of sparked this idea of starting functional medical doctors of America.org. It rooted from her, because she's always telling me it's your gut, you got to eat right. And I never believed her. I was 30 years old with a six pack, and I would wake up with my stomach hurting every day for like months. I'm like, what's going on? I used to be in the restaurant business back then. I used to eat a
uh,
lot of bread. And my sister right away said, it's because you're eating a lot of bread. You're having pizza, you're having sand. I'm like, what are you talking about? Look, I work out, I'm fine. So I didn't believe her. I went to four different conventional doctors. One said you had STD, let's test you for that. I'm like, STD? What does that have to do with it? And somebody else said this hernia, this and that. And then I tried everything. And then I'm like, all right, I'm going to listen to my sister. Cut bread, cut rice, just eat. I don't even think I cut rice. No, it was just bread. I just
yeah,
cut the bread. After 2 weeks, that pain was gone. It was just my gut was inflamed from that. And so I had some kind of, I didn't have it in the past, but I guess I'm sensitive now to gluten. So
yeah,
now I still can eat it. I enjoy it once in a while and nothing will happen. But if I start eating it every day,
yeah.
that pain comes back. So I'm like, all right, from then on, anything my sister said, I was like, okay, I'm on it. I'm on it. Whatever you say, I'm going to do it. At least I test that first. So that's why. And what's sad, Todd, is that people don't even know what functional doctor mean. Like I talk to friends and like I'm like, hey, why don't you have your mom see a functional doctor? They're like, what is a functional doctor? I'm like, well, they look at the root cause, go see
Right.
an integrative doctor like Dr. Born. It's like, that's why I'm like, we need to educate, especially in America. I was raised in Sweden. In Europe, they're way better. I was
Yeah.
born in Iran, raised in Sweden, and then now I live in California. So but US we have a big problem. So that's why I created this website and I want people like you to educate us to let us know, what we're doing wrong.
Right. Right.
So
Yeah, that's great material. And he's like, because people don't know, they don't know what's going on. But yeah, exactly what you're saying is what has driven a lot of people to do what they do. And that's an important thing for people to know. And what's interesting in the United States anyway, because 70% of my practice is the United States, 30% is global, that and naturopathic medicine's been around forever. Nobody knows what a naturopath is, but more and more people don't know. They don't, like you said, they don't necessarily know what functional medicine is or a functional doctor, but they're familiar with the term way more than a naturopath. They're like, what is that kind of weird? Are you gonna give me some herbs and you do some chants or what's going on with some Wicca? You know, so they don't understand it. So even when, so that's what kind of brought me to this phase of more. And it's funny, it's kismet that you and I are connect. Like yesterday, I just basically went off on vitamin D and how it's overprescribed and overused, and there's no sound science on people need these massive doses over prolonged periods and why that actually does more harm than good. And when I speak at conferences, it's the same thing. I'm like, people are like, oh my God, we're going to burn this guy at the stake. It's like, there's no sound evidence that you need things that high. But people like you're healthy, you got all these things going for you, you work out, and all these conventional trained doctors are like, yeah, it's a hernia, or maybe you have IBS. Well, maybe you have a sexually transmitted disease. You're like, what does that have to do with my gut hurting every morning?
Yeah. It's crazy. So tell me, what inspired you to choose the con not to go the conventional route and go the integrative medicine route?
That's a good question because that's where I was going to go. There's conventional doctors in my family, and I was, my undergrad was in biology with an emphasis in human physiology and functional morphology, and I was like, yeah, I'll go to medical school and just be a conventionally trained physician. And then, but as I started, I was always kind of into like more holistic minded. Not that I grew up that way, but into like botanicals and herbs, and like there's got to be other things besides pharmaceuticals. And then I was dating a girl in college who actually grew up. I never heard of a naturopath. She grew up with a naturopathic physician as her pediatrician. And then I had a fungal infection for which is tinea, which is also known as ringworm, but it's a fungus. And it was on my leg and a little bit on my face and my hand. And I go see my dermatologist that I had since I was a kid. And he says, you got cats? And I said, yeah. And he's like, are they kittens? I said, yes. He's like, there's something about kittens that they're harbors. They're for tinea. So I got all these creams, and it's like 3, 4, 5 months in, the infection wasn't getting better, but it wasn't getting any worse. It was just staying there. So, and then he's like, well, now you need to go on antifungals. And I was like, well, yeah. And he's like, we got to monitor your liver enzymes, And I said, well, that just sounds like a lot. And he's down in Phoenix, and I was in Flagstaff, and I was like, plus I know that these drugs have some liver toxicity. So my girlfriend at the time was like, oh, you should see my naturopath. So I go and see them, and it seems I'm pretty skeptical and seems pretty hokey. And he's like, all right, so yep, that's what this is. And so he has a lavender essential oil concentrated soap that he makes, and he's like, wash with this. And he has me take oil of oregano internally, and then believe it or not, talk about old school, he has me take garlic and slice it really thin and apply it to the lesions overnight with a band-aid. 3 weeks later, every single tinea lesion was gone, and it's never been back. And that was 30 years ago, or what? It wasn't 30, it was like 25 years ago. So I was
Wow.
like, hey, there's kind of something to this, right? Where I've seen conventional medicine 6 months in, it's not going away. I see this guy 3 weeks later, it's gone with some natural treatments. And that's kind of what sparked it. And then ultimately, talking to the doctors in my family, they all were saying the same thing. They're like, do you want to be a surgeon? No. They're like, do you want to be an oncologist? No. Even though there are naturopathic oncologists. I was like, no. They're like, you should just go be a naturopath. You'll be able to help way more people than being a conventional physician. And that's what ended up pushing me down the road and going to Bastyr and then completing that medical school and then my residency. And now here we are 15 years later talking to you.
Wow. So naturopath, it's the same kind of like MD. You have to go through all that education.
Yep. So that's a good thing you bring up. Is that there's a misconception. So naturopathic medicine is challenging because if you look at an MD, no matter where in the world, MDs are MDs. They're up here, and they all, no matter which country, the training is mostly the same, except actually in parts of Europe and in Russia, in Cuba, MD curriculum is essentially the same as naturopathic medicine. They still are learning both. So, but then when you see an ND, it's not the same. It depends where they went in the world. So, like an ND in the UK or Australia is not the same as an ND in North America. The training for an ND in North America is doctoral level training. So you have to have all your pre-med prerequisites. You go through 4 to 5 years of medical school. So it's 2 years of basic sciences, two to
Wow.
three years of your clinical sciences. You have to have your board exams. The only difference really is that for the most part, like outside of a few medical schools like Johns Hopkins and Yale, the actual didactic portion of your curriculum as an ND is longer because we have to do pharmaceuticals, we have to do botanical medicine, diet nutrient therapies, homeopathy, chiropractic medicine, except we can't call it chiropractic because they own the term. We call it osseous manipulation therapy, and it's all taught mostly by chiropractors. So you learn that, and then but otherwise the curriculum is the same, just a little bit longer. And the other thing is that since Medicare covers most of the funding for conventional medical residencies, the naturopathic residencies are a lot smaller. So in North America, you might have 400 or 500 graduates every year, which isn't that many compared to conventional medicine. You know, we're a small but mighty bunch. There's maybe 30 accredited residencies. So they're very competitive, very difficult to get into. I was fortunate to get one. And then during my residency, I rotated through 2 emergency medicine departments. I was at Swedish Families Integrative Medicine. You know, I was at Virginia Mason's Department of Phys Med and Rehab Spine Clinic. So I got to train right along as conventional doctors as well as doing my naturopathic residency.
Oh, I had no idea. That's good to know. So, but what I saw in one of your titles is that's considered integrative anyways, right? Integrative and functional.
Yep.
Because you look at the root cause,
Correct. Yeah.
right?
So a lot of people are saying, I even had a video of this. I haven't published it yet, but it's like, what is the difference? What are the similarities and the differences between naturopathic, functional, and integrative medicines? And there's a lot of similarities. Naturopathic medicine is really that bigger umbrella because it's been around the longest that integrative and functional medicine kind of broke out of. So even if you look at a lot of the integrative medicine fellowships and the Institute of Functional Medicine, the curriculum is written by mostly NDs. It's just that NDs don't have that same prestige. The degree doesn't have the same prestige as an MD or DO, and that's just the way it is. And I accept that. I'm comfortable in my own shoes and confident in my abilities. So
Right.
integrative medicine really was kind of when Dr. Andrew Weil in the, maybe the 90s was like, hey, there's some alternatives that you can use that are founded in some solid science and clinical, science, clinical based medicine that isn't, say, snake oil, but used in tandem with conventional medicines. And integrative oncology is one of the say the areas that shines well, where you're getting your conventional chemotherapy and radiation, but you're bringing naturopathic therapies, holistic therapies on board, so you can tolerate those therapies. The therapies work better. You have less side effects, so you can actually finish the chemo. All these things, the fatigue, the anemias, the neuropathies that happen. Functional medicine is a newer term that I think has done a better job being out there that people will recognize. They may not know what functional medicine is per se, but they kind of get the idea that it's all root cause finding. So if someone has hypothyroidism, instead of just giving them levothyroxine and sending them on their way, it's like, well, why do they have a low active thyroid? Let's get to the underlying cause. And if we can find that reason, then the thyroid can be corrected and they won't need medication for life, for example. So they're all holistic, as far as root cause medicine.
It's it's funny you brought up thyroid. There's so many people having problems with thyroid now. Like my buddy is like my age, 44, and he is like he had to get operation and this and that. What is the root cause of it and where is it coming from, dude?
It's a good question. Depends on the thyroid disease. So there's uncomplicated hypothyroidism, which means you don't have any antibodies to it. The next one would be Hashimoto's thyroiditis, which is autoimmune thyroid disease, which is what 90% of the thyroid disease is in the industrialized world. Then there's hyperthyroidism.
Oh, that's it, hyper.
Yeah,
His metabolism was super high. He was always sweating.
yeah, that's
Okay.
Graves' disease. And there's a lot of postulated theories. And then again, functional medicine, naturopathic medicine, what's nice is that it doesn't look at just one possibility, right? It looks at the tandem, the totality of them. It's like, well, were there some heavy metals at play? Did you have an infection? Did you have, this, and this? Most of the time, people end up, at least I've seen a lot of Graves' disease, and I have yet to see a patient, knock on wood, who actually needed either a thyroidectomy or to have their thyroid ablated with radioactive iodine. I've been able to make people euthyroid with natural medicines by taking that holistic approach. So we look at, are there food sensitivities or, food allergies and intolerances? Because those are all very different. Was there a viral component? How do we get it? Because it's an autoimmune reaction, same with Hashimoto's. How do we get those antibodies down to stop attacking the thyroid, and then you become euthyroid? And I mean, obviously, there are Graves' disease is not something you want to mess around with, right? Because you can have cardiac issues and kidney issues, and then you get the exophthalmos, the bulging eyes, But I've had people with well advanced Graves and still make them euthyroid. So there's multiple causes. We just have to find out what it is.
that the last part you just mentioned is my other friend with his eyes bulging out. It's so that's two friends right now, close friends of mine that are dealing with thyroidism. So as
Yeah.
a naturopath, what patients or conditions do you see often? Like people out there when they think of a naturopath, or maybe in your practice, what kind of conditions do you see most often? Is it what we just talked about a little bit? And
Right. So I see a lot of everything, like your routine, your diabetes, your hypertension, your gut issues, and your fatigue, and your insomnia, and your mood disorders. I like some naturopaths like to specialize. Like I'm the thyroid woman. For me, I couldn't do the same thing all day, seeing the same thing. It would just get boring and tedious. So I like to see a lot of everything. So my practice, though I see a lot of everything, it's the reason that people are typically referred to me, which is 85% to 90% of my practice, is that it's a family, a friend, a loved one that is referring them to me, probably about 85%. The other 10% is me, on podcasts, or I'm speaking at conferences. So then that doctor then refers, or they read an article I wrote or something like that, or I was on a summit, these international health summits that go for like 4 days, and there's 60 experts speaking. I might be brought in to speak on a couple of conditions. That's where the most of the foreign patients come in, right? The ones that are in Europe, my international patients. I'm usually on a summit or a podcast that they hear me on. But most people see me because they're either difficult to treat, a refractory case, so maybe they have an autoimmune disease and they failed all medications, or they were intolerant to medications, or they're on the meds and they're not working that well. So now they're on 3 or 4 meds to help control their autoimmune disease. So then they're like, look, you know, you got to go see this guy. I don't even know what he does, but Dr. Born seems to be able to figure it out and get you better. And I get, some people who just that maybe they have Graves' disease and they're newly diagnosed and they're like, I want to know if there's an alternative. But generally speaking, with functional medicine doctors, naturopaths, those integrative doctors, the reason people see someone like me is one of kind of a few camps. For the most part, right, as you well know, I mean, you're an international guy, right? You're from 3 different countries, and now you live here, and you've lived in a lot of places that people are sick and tired of being sick and tired, right? They go to their doctor in the United States, and I have patients all over the world, so we're not the only one that's culpable of this. You got 10 minutes with them. There's not enough time in 10 minutes to really get to the root cause. You're there to triage them until the next visit and just palliate them and just keep them going. And that's why a lot of people are tired of that. They're like, I'm just tired of, and half the time now you don't even see the doctor anymore. You see a mid-level practitioner, nurse practitioner, or PA. And I'm not knocking them, but their level of training, they should not be utilized at the level physician because they don't have that much training, right? It's not 4 years of medical school and a 3 to 5 year residency. They should be used what it's supposed to be to help the system and help patients, even for like follow-ups. So a lot of people either that they're too complicated and they're really sick, so they end up in seeing someone like me. You also get what I like to call, not to be pejorative, but the antis. These are ones that are anti-establishment, anti-conventional medicine. They just refuse to take an antibiotic, so they want the holistic approach, the naturopath. And then I do get some of those, and I'm like, there's a time and place for everything. And I can prescribe medications. I do frequently when they're needed, more judiciously than my conventional brethren. That's because I have more tools in my toolbox. My armamentarium is bigger than just medications. Then you get, so you get the antis, you get the people who are not well controlled on their medications. You want people that just are looking for another option. I have a child. My child has ADHD. They want them on, stimulants. Is there something else that can be done besides putting my 7-year-old on, some type of, amphetamine? So usually that's who you kind of get. So there's a rise in this medicine because more and more people are becoming more complicated and they're tired of just being given a bunch of pills and moved on to the next visit without actually trying to find out what's going on.
I really like you said you have more tools in your belt. You really do. And it makes sense now why conventional doctors go the route they go because they have no other options. What they have learned is,
Yep.
okay, when this happens, use this pill. If that pill didn't work, use this pill.
Yep.
If this pill didn't work, then it's surgery,
Yep.
right?
Yep.
So that's I never heard that, but that's really good. I'm gonna have my sister use that.
Yeah, that's the convention. It's very algorithmic, and I like algorithms. But you got to be able to think outside the algorithms, and that's typically who sees us, right? There's a bell curve in medicine. The area under the curve are the people that have a disease and they respond well to the medication, or pretty well. The outliers, who are the non-responders, end up seeing someone like your sister, who's a functional medicine doctor, or someone like me, who's a naturopathic physician, because they're just not doing well. Whatever their health conditions, or they might have a condition that conventional medicine doesn't do well with: fibromyalgia, chronic fatigue syndrome, these kind of more tick-borne illnesses outside of the acute phase of, say, Lyme, where most people respond to doxycycline, the antibiotic. Then they're like, well, you have IBS, not real good with IBS, go see the naturopath.
Yeah. That makes sense. We kind of covered this next question, but maybe having it by itself and you can just give me a quick answer, then it could be a good video clip. So, in your own words, how would you explain the difference between functional medicine and conventional medicine?
Honestly, the main thing is the holistic approach. In conventional medicine, and most of my really good colleagues and friends, they're all conventional doctors, usually conventionally trained, but the reason they're close is that we're like-minded. I might have met them at a functional medicine conference, so now they're a functional medicine psychiatrist, or whatever. But
Okay.
the main difference is that holistic approach, right? In medicine now, you go and see your GP, outside of an acute, sprain, strain, cough, cold, right? Conventional medicine is very deft and well equipped for acute, urgent, and emergent matters. It's not really well equipped for chronic disease, and that's what most people have, right? If you have an acute illness, you either survive or you die. That's just basic biology 101. So in conventional medicine nowadays, unfortunately, you see the GP and they're like, "Oh, that's your thyroid, you go to endo. That's your gut, go to gastro. That's your knee pain, you go to ortho or PT." They don't really do that holistic approach like when you and I grew up. I mean, my pediatrician was doing everything. They never referred you out, right? Unless they needed a specialist. Nobody really does it anymore. It's just all referred out, and so there's nobody controlling anything. For functional medicine, really can treat, like with me, if someone comes in and they have 13, chief complaints on their problem list, I'm like, I'll be able to handle all of those. And some of them I might be like, well, I need to send you to rheumatology to get, I need their diagnostic prowess to make sure we have an accurate diagnosis. And then once I know for sure if you have rheumatoid arthritis or whatever, then I can start doing this. But uh, functional medicine tends to take that holistic view, and again is saying, why do you have that condition? Conventional medicine doesn't care why you have. And I'll give you an example with Hashimoto's thyroiditis. Someone has hypothyroidism. Conventionally trained doctors are not taught to run antibodies, right? They don't care. And I always talk to when I speak at conferences, and they'll say, well, why don't you test antibodies? Like, because it's not going to change the treatment. Either way, they're going to get put on levothyroxine, which is, Synthroid is the brand name of it, which is just T4. And I say, well, my argument is if someone has one autoimmune disease, they're more likely to have other autoimmune diseases. So wouldn't you want to know if you have an autoimmune disease? And my conventional colleagues are like, well, yeah, but there's no but. You just do it. Plus, they in the naturopathic approach, it's actually almost easier to get someone to be euthyroid when they have Hashimoto's, because you can actually go at those antibodies, where someone doesn't have antibodies. I wouldn't say it's hard to treat. It's just they're not as responsive as to some of the other interventions. So really, it's whole cause approach and the underlying aspect of why someone has that disease, versus conventional medicine's like doesn't like care, right? It's like, well, you have thyroid disease, you take this. We don't care why you got it.
Right. Okay. Totally makes sense. Okay, so why don't you share one of your patient success story that really represent the impact of your approach? Can you do that for us?
Yeah, I can give you one, I guess that's simple for this platform, right? Versus like one of the super, super complicated patients. So I have a patient who has osteoporosis and Graves' disease. Those are common because when you have Graves' disease, like your friend, it's a hypermetabolic state. So these people, they tend to have anxiety, palpitations, insomnia, and they're intolerant to heat, and they tend to have everything's in overdrive. So they're losing weight, they're getting their bones turning over quicker. So Graves' disease isn't just thyroid, right? There's all these systems because the body is in constant crosstalk with each other. So it's a great kind of picture to see what other organ systems can be have problems with from having one disease. So she came and saw. She's been a patient of mine for more than 10 years, and very smart woman. You know, she's a physicist, she's a chemist. She actually worked at a pharmaceutical company, and so she actually started out with Hashimoto's, then it ended up with Graves, which you'll see. So she went hypo to hyper, and she saw an endocrinologist, and they're like, look, she was intolerant to methimazole and PTU. Those are the two major drugs that block thyroid hormone. So she's out of options. The only other options is we either cut out your thyroid or we give you a whole bunch of radioactive iodine and we basically nuke your thyroid. She's like, I don't want to do that. If that's, last resort, that doesn't mean there's cases sometimes you got to do that, right? But she came to me. She was referred to me not by an endocrinologist, but I can't remember, a family member or something. So I was like, yeah, we can do a lot of things, So over time, looked at everything, why she has Graves. We talked, she's started after a viral illness, but that was a long time ago. So there was really no virus to it or infection to attack. But doesn't mean we didn't want to modulate her immune system because she was always getting sick. She was already doing gluten-free diet anyway because she said that going gluten-free helped her gut. And so she's like, I just did that. So we looked at some food sensitivities, and just as a side note, there is a difference between for your audience, there is a difference between a food sensitivity, a food intolerance, and food allergy. Most people, even physicians, lump those all into the same thing, and that's not true. So a true food allergy is mediated by the immune system. That's when you eat the shrimp, right, and your face blows up, or you get hives, or you can become anaphylactic. That's a true food allergy. It's a type 1 IgE mediated hypersensitivity. Food intolerances are not mediated by the immune system. They're usually an enzyme insufficiency or deficiency in the gut, lactose intolerance being the most common food intolerance in the industrialized world, where you don't have enough of the enzyme lactase to break down the milk sugar lactose, and you do not get symptoms outside of the gastrointestinal tract. A food sensitivity is more where us functional medicine naturopaths, the world we live in, where they may or may not be mediated by immune system, and you might get an IgG type 3 delayed reaction, but not always. So the only way to really know is the gold standard is the allergy elimination diet. You remove the foods for 2 weeks, and then you start challenging those foods. So we found a couple more foods with her, and then literally just gave her some herbs that block thyroid, and also herbs protect her heart. And you don't have to give much of them. There are low dose herbs. She became euthyroid. I gave her some stuff about osteoporosis exercises, prevention exercises, bone building, weight bearing. Gave her an osteoporosis diet handout, which is basically like a more whole foods, plant-based diet. And then gave her some bone building ingredients, a formula that is more than just the calcium, magnesium, and vitamin D that everybody's familiar with. Your bone is a dynamic organ. It needs a lot more nutrients than that, like strontium and silicon and boron and some other things. She went from being Graves' disease to no Graves' disease, all her symptoms resolved, and she went from being osteoporotic to osteopenic. So the endocrinologist was like, first of all, this is unheard of. If you have Graves' disease, it has to be treated. You don't get treated by natural medicine, but okay. But what's even more remarkable was when you're osteoporotic, you don't actually go the other way. She became osteopenic. She actually improved bone with no bisphosphonates, nothing. So he was incredulous, which is fine, but he's like, look, it's obviously working, right? The numbers, the objective tests, the lab tests, the DEXA showed this, and he's just like, just keep seeing the naturopathic doctor. That guy retired, still sees me, saw a new endocrinologist, and she wanted to do other things, but she's like, but I'm fine. Why do you need to take my thyroid out? Why do you need to do this? I'm well controlled by this guy. And then she had some osteoarthritis in her hand. I gave her a homeopathic Ruta, which is a classic kind of bone pain remedy. She takes it a couple times a week. Osteoarthritis is now improving, and so you can see, I mean, this is pretty classic, pretty somewhat complicated case, handled pretty strategically and systematically, and with a holistic approach. I'm going to treat this, and this. I'm going to give you some CoQ10 to protect your heart and kidneys from the Graves. I'm going to give you some stuff to block the thyroid hormone, and I'm going to rebuild your bones. She's
Nice.
still with me 12 years later. She's been my patient.
Nice. How long did that process takes for her just to
To get her euthyroid, that was about 3 months,
three
which
months?
is basically quicker than the medications would work. And
Yeah.
then to the osteoporosis, it was slower, but because you repeat. So in my system of medicine, the way I do things doesn't mean everybody does it this way. In my training is the difference in conventional medicine, right? Is that for the most part, it's all the same. Where which is a good thing and a bad thing. In naturopathic functional medicine, you can get 5 doctors in a room with one disease. You'll get 100 different ways to treat it, which is also good and bad, right? There's no systematic standard of care, which can not be great for certain situations, but it also lends itself well to be able to pivot and be holistic. So I think both systems of medicine need a little bit more balance in that, and that's what I try to bring to naturopathic medicine when I teach at when I'm presenting at medical conferences. I'll be asked to speak on certain diseases and autoimmune diseases, or even like high umbrella mood disorders. And I'm like, here's how I systematically do everything, no matter what the mood disorder is. And then here's targeted approaches for anxiety or depression or schizophrenia or what have you. But yeah, for her osteoporosis, and then I don't want to wait 2 years for a DEXA, right, which is an X-ray, it's radiation. So I run a blood and a urine test, which looks at how fast the bone is turning over. So as I do an intervention, I'll give it a month, 6 weeks, and then I'll retest them. If those bone markers aren't coming down, then I have to bring in either something else or be more aggressive, because the labs are telling me that her bone is still turning over quickly. I don't want to wait 2 years, which is conventional medicine. It's like, here's a bisphosphonate, we'll see you in 2 years. Well, you could have a lot of bone loss in 2 years, and osteoporosis is no joke, right? When you get older, you fall, you break a hip. Men and women who break a hip are more likely to be hospitalized, and they're more likely to die
Mm.
sooner. And then also, mobility issues. You break a hip, so I don't want to wait. I like to work quickly and get results. So thyroid was resolved within 3 months, and then within a year, her bones started reversing and going back to osteopenic, and she's building more and more bone even to this day. And will she have not be osteopenic anymore? I don't know. I mean, um, it's the her new DEXA will be this month, so I'll tell you if it's still going in the
Okay,
right
great.
direction.
Wow, that's an amazing story. So, when a new patient comes to you frustrated and confused, what is your process for getting to the root of their issue? And especially when because you work telehealth, you can help anybody in the world.
Yeah, yeah, and that's why I went to telehealth, because when I was practicing in my wife and I practiced in Connecticut after residency, then we were in California, and I was getting a fair amount of referrals from colleagues like, oh, I don't do tick-borne illnesses, but this guy does. This is back in the days when there was still Skype. And so I was like, doing this more and more. And so by 2018, I was like, we were going to move out of California and sell the practice anyway to one of our associates. I was like, I'm just going to just move to all telehealth, and no more employees, no more contractors, no more staff, no more nothing, just me. And that, which frees me up to be more one-on-one, and also now a farther outreach with telehealth. And then this was before COVID. Then COVID happened, just made me busier and more.
Right.
But for me, again, I'm highly strategic and systematic. So patients are coming to see me. I love the simple cases, but I don't get those that often, right? Maybe if I see 10 patients a week, because I divide my time between, the dietary supplement industry, and I also consult for a pharmaceutical company, and I'm consult and advise in a medical group. So I will be like, I tend to see the more complicated cases, but since most people refer to me, they kind of know what they're getting into, and they're just so relieved. One, someone finally listens. Two, someone knows what they're doing. And three, as they go through their problems on my intake forms, because people might want 50 things handled. That's not really feasible in one visit. So I usually, in my intake forms, I'll say, tell me the 5 most important things that you want to address. And then as you appointments unfold, more and more stuff kind of comes up. But if you treat one thing holistically, a couple other things just kind of resolve on their own. And so for me, it's like I listen to their story, and it works no different than any other normal appointment you would have in person or with a conventional doc or what have you. Is that it's a history, you know, tell me about everything that's been going on, what's worked for you, what's not worked, what makes it better or worse. Send me some lab results you've had in the last 6 months, because past 6 months, they're not really relevant to me. Any imaging, diagnostic imaging reports from the radiologist you've had in the last year, or if you've had an emergency room visit. I take all those records, I review them. And then as they're telling me their story after 15 years of practice in all medicine, there's a differential diagnosis that runs through your head. So as I start to ask more close-ended questions, or yes or no, not open-ended, I can whittle it down to a pretty good idea of what's going on with them. Um, they may come in with 10 concerns, six of which have already been diagnosed, right? I've got insomnia, I've got rheumatoid arthritis, I've got this. But then the rest is for me to find out. And then that's when I order a whole bunch of tests, insurance covers them, and then I might order some functional tests like stool cultures and then I start to basically peel away the layer of their onion until I'm like, all right, and then they come back for the second visit. I'm like, what are the homeopathic do and not do I gave you? Here's what the lab showed. They always come in with bags of supplements. I'm like, finish all of those up because I'm going to consolidate it down to just a couple. And then I just keep peeling away the layers of the onion. And they're just so relieved, especially people who I'm their last stop, right? They're like, I've seen everybody. And I am just so ill health. I'm on disability, can't get out of bed in the morning. And I always say, look, you're going to get tired of seeing me before I run out of options. And I'm not joking, is that they will. They'll just be like, all right, they've been with this guy for a year. But I at this point, if I'm with someone for 3, 4 months, I'm not getting anywhere. I'm going to refer them to someone. I'm obviously missing something. But yeah, so it's just peeling away the layers one after another.
That makes sense. That's like with everything, Sometimes I run ads for some clients and it doesn't work. And I just say, sorry, you know what? Google Ads is not working for your industry, but you should try Facebook and Instagram ads. And then I refer them out. So it's kind of the same thing. So the next thing I want to talk about, what do you wish more people understood about hormones, gut health, inflammation, or autoimmunity?
That's quite the. We could have a whole podcast on just that. Honestly, the high level is they're all connected. And that's, again, one of the strengths of functional naturopathic medicine or conventional medicine. You know how many gastroenterologists I have spoken to over the years that say that patient's Crohn's disease or their irritable bowel syndrome or their ulcerative colitis has nothing to do with their diet. And I'm like, but just common sense, that makes no sense, right? Is that you can't tell me that something that someone is putting into their gastrointestinal tract does not have an effect on the gastrointestinal tract. And science bears this out if you just look at the studies. So they're all at play. And this is one of the things that I speak a lot about at conferences. Like there's this presentation I give a lot. It's I present 21 cases of like the most difficult cases you will probably ever see in your practice if you ever see them. Just really, really layered. And how do I approach it? So when you get people that come in and it's easy even as the physician for it to be very cumbersome to like, oh my god, what am I going to do with this person? They've got 15 things going on. Their labs are a mess. They're a mess. Everything's a mess, right? We just wish there was a ICD-10 code that was a hot mess, but you can't. And so you guys, you kind of whittle down, it's like, what if you just treat the underlying cause, the big things? Stop chasing the lab, stop chasing this, right? I mean, labs are great, they're very helpful. I'm known as a vampire. I run a lot of blood tests because I really need to understand what's going on. Plus, humans in general are pretty subjective creatures. We like data. It makes them more adherent to my
Yeah,
recommendations because they're like, Dr. Born's going to test me in
that's
three
true.
months. I got to get this down. I got to get this inflammatory marker down. But when you fix a couple of these key things, what you'll start to notice in the patient, and this also comes with years of experience in practice. It doesn't have in the beginning because you haven't seen it enough. Because medicine does tend to be pretty predictable after a while. That's why if you've ever seen an emergency room physician who's been in practice a long time, they can walk in there and be like, this person's got this. And they haven't even done anything yet. They just seen it so many times, right? The
Mhm.
horses in the room, not the zebras. So if you fix these couple things, all of a sudden the hormones start normalizing. You know, the inflammation goes down, particularly treating the gastrointestinal tract, because that is where most of our immune system is. A lot of our neurotransmitters are made, our hormones are made, and we have obviously our organs make them. So people need to understand, um, the general public and clinicians, that everything is in constant crosstalk. So if you address a few and fix those, all these other ones tend to normalize themselves.
That's perfect answer. So the simple answer would be everything is connected. Like
Yep.
you, like I feel like when you're talking, you're always bringing that up. Like you fix one thing and another thing is gonna naturally get fixed. You fix this thing and then this thing is gonna get fixed. So that totally makes sense, right? Because everything is connected.
Yeah, in
Yeah.
conventional medicine, it's a little more of the whack-a-mole approach, right? And that's not to blame the system. I'm not blaming the clinician. I'm blaming the system. The American system, the conventional model, right, is well, that's not. I have so many patients where their doctor, the specialists, don't even talk to each other. I'm like, well, you're on redundant meds. There's a reason you're over medicated. You're now hypotensive. You're on too many meds. Who prescribed you this? Who prescribed you that? And they're like, well, my GP did this. My internist has got that. And my, cardiologist got that. I was like, well, who's monitoring these? They're like, nobody. That's why I'm seeing you. And so I'm like, all right, well, I'll try to rein it all in. I'll get people talking. I'm a good communicator, and and that's right. Is that it's whack-a-mole, and that's how people get put on these polypharmacies, right? Is that you're not tolerating that med, or it's not working well enough. We're gonna add this one in. We're gonna add this one in. You're gonna add this one in. They're not treating the system as a whole.
Got it. All right, we're getting to the end of this interview. So, if you could give one message to the patients across America who are struggling with their health, what would you want them to know?
There's always an option, right? I mean, even if you've got some what I call the SRPs, the strange, rare, and peculiar diseases, like obscure. I get a lot of people that don't even have a diagnosis, right? They just have a constellation of symptoms. They may get lumped into a syndrome, chronic fatigue syndrome, fibromyalgia, whatever, and they're like, "Well, we're not that good. Irritable bowel syndrome. Go see this guy." That there are options, and they're effective. A lot of people think, and I see this all. I read a lot of Medscape and I see them they're getting better. It's a very conventional doctor's, site, but they'll poo-poo anything that isn't a pharmaceutical. And you're like, well, up to the advent of penicillin in the 50s, all medical schools curriculum were herbs and homeopathy and diet and counseling. You know, it wasn't until the advent of antibiotics. So you can't tell me that for thousands of years humans have been using things to treat things that were not antibiotics. And I'm not against conventional medicine. But knowing that there's always an option and there's ways that you can be cured or at least substantial improvement in quality of life. Like if someone comes to me and they've had psoriatic arthritis for 35 years and their fingers are like this and they want me to cure them, I was like, here's the way in reality, right, is that those joints have fused, but I can get it to where you're maybe just down on one med, low dose, so you're not having as many side effects, and I can slow down further hastening of your disease and improve your quality of life, and then that makes them pretty happy. But some of them just think they're going to be cured after 35 years of disease, and that's not always the case.
So, I love the underlying message. There are more options out there. Don't give
Yeah,
up. That's it, right?
yeah,
All right.
exactly.
Awesome. Well, where can people find you? Thank you again for your time, Dr. Bourne. I really appreciate it. I learned a lot, and I'm gonna definitely do more of these because I feel like it's gonna definitely improve the quality of my life and the thousands that we are going to impact with functional medical doctors of America.org. So where is the best place people can reach you? I know you're working on your YouTube channel and you're getting your Instagram going, but right now, would it be your website?
Yeah, I mean that's exactly. I mean, if you can Google my name or go to bornintegrativemedicine.com, that's where you find all the information. And we have a new site. I finally caved again. I didn't do anything for 10 years, and after everybody hounded me, I'm like, fine, I'll get the social media stuff going, disseminate useful information. I'll get a new website, and so yeah, that's the easiest way. And there's a contact form on there. But if you just Google my name, I have lots of health articles and other podcasts. I've given a lot of speaking on health topics that have been thrown onto YouTube. And but yeah, just my website's probably the place to start.
So if they YouTube your name, Dr. Todd A. Born, they would find your videos on YouTube from other interviews.
Yeah, you'll see like I did there's one on ADHD, there's a pain, chronic pain, other over the years where people have interviewed me or like during COVID when I was giving presentations at medical conferences for continuing medical education units. Those were almost always invariably thrown up on YouTube because there weren't other platforms then.
Awesome, awesome. Thanks again. And I'm sure we'll connect again, talk about other things that you're doing.
Yeah, right. Thank you, sir.
All right, Todd,
All right.
take care.
Take care. See ya.
Goodbye.
Bye.